The Healthcare Strategy Forum think tank was all about how BT developing its current telehealth technology solution to support clinical pathways and really help the health service redesign the healthcare delivery and clinical pathways. So we come from a standpoint of putting the pathways and redesign first, and then thinking how can BT support those transformational care pathways. The think tank that we had this evening was very much a two-way street. So we were able just to stimulate that conversation by saying what we're doing and planning. But the think tank was very much about people coming backwards and forwards, challenging us in some of the things we were saying, obviously, but also thinking about how they can adopt the type of approach that we've got to their particular clinical areas. For example, one of the colleagues was talking about heart failure, also how challenges she's got with medication levels for mental health patients, etc. So actually we had a very good dialogue about what our approach is in terms of its technology agnostic, linking into a health platform that we're going to do this once, and then it's going to enable large-scale adoption by the fact that it's going to be low cost because you're only going to use the service as a pay-as-you-go service. So actually that's stimulating people to think about how can that type of infrastructure be used in their particular clinical area. So it was a really good, I would say, two-way discussing think tank. Yeah. In terms of what we're going to do, I think to obviously take that message back, we need to make sure that we ensure that we address some of those issues that sometimes the health service might want to do it themselves. The other issue we talked about was N3, which sometimes has bad press, and sometimes people get frustrated with that. So I'm very much going to take that back to our N3 team. We're also going to take some very positive messages back because there was a huge amount of enthusiasm for moving face-to-face care perhaps in GP surgeries to much more in a virtual environment, because that's going to save money, it's going to be much cheaper to do that. So I've also taken some very positive messages back that actually our approach and what we're saying is absolutely the right one. There was some very positive feedback that we got from the think tank as well. Certainly BT have found it very valuable, the whole conference approach. I personally have only just been here this afternoon, so I've kind of just flown in. But I know that what we've been able to do is use the opportunity to continue some of the conversations. So some of the people we know well, and it's allowed us to continue conversations. It's also allowed us to meet new people. And for me to think about, actually, or for the NHS to think about, actually, we think of BT as a communications provider, and actually thinking about BT in a different light, and it gives us an opportunity to put that. It also allows us to talk about some of the really positive things we've done, and we've had some very positive feedbacks from the Department of Health around mobile health worker, and how we can really support the efficiency agenda of EQUIP agenda in terms of efficiency, quality, etc., and are really standing behind that agenda. In summary, I'd like to say that BT is passionate about supporting the NHS to remove the barriers to large-scale telehealth adoption, and so we're wanting to make it very low cost, easy to install, easy to use, and only pay for it when it's being used on a revenue model. So it enables the NHS to get the efficiencies that they need, but also that at the end of their day that patients get the benefit from what I believe is a fantastic way of supporting patients. Well, this is my first think tank. I've certainly, in the discussions that I've had with people that have regularly done these, they certainly, in terms of the people that are coming from the NHS, feel it very, very valuable. I think it gives an opportunity, rather than just people sitting listening, to have that engagement. So the kind of speed dating and the meeting is I think is a very positive one, because there's no pressure on either side. You can have conversations, people can come and go, but actually you're allowing certainly the NHS to have time to do some thinking, which is obviously the whole thing about think tanks. So I found it a very positive experience, and I know the NHS attendees have found it a very positive experience, and I know BT has supported these previously, and I think we'll continue to do so. The Healthcare Strategy Forum is an excellent way for BT to engage with purchasers of healthcare, commissioners of healthcare, providers of healthcare, IT directors, and also clinicians and clinician managers. So it allows us to engage with a whole range of really key people in the NHS to enable us to get our message over about how we're supporting moving the EQUIP agenda and telehealth forward in the future.